All right, welcome back, everyone. Today we're zeroing in on something that, well, it carries this huge human and economic burden everywhere. Lung cancer impacts millions, and the costs, they're just staggering, touches every part of healthcare. Okay, let's unpack this because we're diving into a really fascinating real-life study from Turkey, first of its kind there, apparently, gives us a critical look at actual healthcare spending for lung cancer within their national system.
That's right. And globally, I mean, the scale is immense. The WHO, they reported about 2.5 million new cases just in 2023. So it's the most common carcinoma and, yeah, tragically, the leading cause of cancer death.
Wow. 2.5 million.
Yeah, and Turkey, unfortunately, it pretty much mirrors that grim trend. Their stats show it's the most observed cancer type, responsible for nearly 30% of all cancer deaths in, well, 2021 and 22 figures show that.
Almost a third. That's huge.
It is. And the economic hit, just massive. You look at the U.S., one study mentioned something like $21.3 billion lost from the workforce because of cancer, or the EU lung cancer alone eats up $18.8 billion. That's like 15% of their whole cancer budget.
15% just for lung cancer.
Exactly. And what's been missing really noticeably is that kind of specific real-world cost data for Turkey. So that's the gap this study really aimed to fill.
Right. So as we get into this deep dive, our mission really is to understand what's driving these costs, specifically in Turkey's system, and what does this mean for patients, for policymakers, maybe globally, and for you listening. So let's talk about how they actually did this. The study's foundation, it covered a pretty long period, 10 years, right, 2013 to 2022, all at one specialized lung center in Turkey. And they started with this, well, enormous data set, almost 200,000 patient admissions.
Yeah, it was substantial. And from that huge number, they applied really strict criteria to filter down, make sure they were looking at definite lung cancer cases, ended up focusing on just under 5,000 unique patients, 4,991. And for these patients, they gathered a ton of data, meticulously. Demographics, sure, but also the exact type of cancer, how it was diagnosed, surgery, needle aspiration, EBUS, plus all the treatments, chemo, radiation, palliative care, even antibiotics used, and crucially, the cost for every single step.
And how did they pin down those costs?
They used what's called the Health Implementation Communique prices. It's basically the standard government-set rates for medical services in Turkey. So a uniform baseline. All the costs were in Turkish lira initially, then converted to U.S. dollars using the central bank's yearly exchange rates.
Got it. And they also looked at staging, didn't they? But maybe broader categories.
That's right. They grouped it into local, locally advanced, and metastatic. And those stages, along with the cancer subtype, the diagnostic methods, whether the patient was hospitalized, all seen as key factors potentially affecting the final cost.
Okay, so rigorous data collection, clear methods. What did they find? What's the headline?
Well, the main number is the average healthcare cost per patient during treatment came out to about $4,289 US dollars. The median, which is often a better measure in these cases, was lower, around $3,220 US dollars.
$3,200 median.
Okay.
And the patient group itself?
Yeah, heavily skewed male, 88.3%.
Okay.
Average age was just over 70.
Right. And did the costs vary much within that group?
Oh, definitely. Some clear patterns emerged. For instance, male patients had slightly higher average costs, about $3,260 versus just under $3,000 for females. But a really big difference was treatment location. Patients treated only as inpatients, and that was almost 70% of them. They had nearly double the cost compared to those who had a mix of inpatient and outpatient care.
Double. Wow. That's significant.
It is. And survival mattered, too. Survivors averaged lower costs, around $2,865. Non-survivors were higher, averaging $4,230.
Makes sense, sadly. Longer, perhaps more complex care needed?
Yeah. Exactly. And that ties into hospitalization duration. There was a strong positive correlation. Basically, the more days spent in the hospital, the higher the costs. Pretty direct link. They even put a number on it, a row value of 0.660, which is statistically strong. Mean stay was 33 days, median 26.
Okay.
Interestingly, age showed a weak negative correlation. Slightly lower costs for older patients on average.
Huh. Okay, that breakdown by gender, hospitalization, survival already gives us a lot to chew on. But here's where it gets really interesting. When you start slicing the data by the specific cancer type and the stage, what did that reveal?
Yeah, this is crucial. So the study confirmed NSCLC, non-small cell lung carcinoma, was dominant, 85% of cases. Within that, squamous cell, SCC, was most common, almost 37%. Then adenocarcinoma at about 29%. Small cell, SCLC, was next, nearly 21%. And carcinoid tumors are really rare, less than 0.5%.
In staging, where were most people diagnosed?
Unfortunately, mostly late stage, 61% advanced, another 18% metastatic.
That's tough. Okay, but you mentioned something surprising earlier about costs.
Yes. The non-diagnostic group. It was small, only 2.3% of patients where they couldn't pin down a specific subtype definitively during the study period. But this group actually had higher overall costs and longer hospital stays than almost all the groups with a defined cancer type.
So the difficulty in just getting the diagnosis drove up the cost.
Absolutely. It really highlights those hidden costs of, medical uncertainty. Think about it. Before you have that clear diagnosis, you might have repeat scans, maybe multiple biopsies, different kinds of specialists. All that adds up before you can even start a targeted treatment. So for that small group, this diagnostic journey itself becomes a big cost driver.
That's a really important point. Okay, so beyond that, what about the link between stage and cost for the defined cancer types?
Right. So generally, for NSCLC types like squamous cell and adenocarcinoma, patients with locally advanced disease tended to have the highest costs and longest hospital stays.
Okay, locally advanced NSCLC, highest cost.
Generally, yes. But OBT, for SCLC, small cell lung carcinoma, it flipped. The highest expenditure was seen at the limited stage, not the locally advanced or extensive stage.
Wait, why the difference? Why limited stage for SCLC?
It's likely due to the treatment pathways. SCLC is often very aggressive, and treatment options become much more limited, often shifting towards palliative care as it progresses. So the intensive treatments might happen more at that initial limited stage, whereas with NSCLC, you have more options, including newer, often expensive immunotherapies or targeted drugs that might be used even in locally advanced or sometimes later stages, pushing those costs up.
Ah, okay. So the available treatments at different stages really shape the cost curve differently for SCLC versus NSCLC.
Precisely. And just to round that out, carcinoid tumors, being generally less aggressive, consistently have the lowest cost compared to the others at both limited and advanced stages.
Fascinating. So understanding these nuances, subtype, stage, and the available treatments is clearly vital for managing resources effectively. Okay, so we have this incredibly detailed picture from Turkey. But the big question, so what does this all mean? How does this $3,200 median cost stack up globally?
Yeah, this is where it gets quite striking. Let's look at some other countries. China reported an average burden per patient of over $43,000 US.
43,000.
Yeah. South Korea, $3.3 billion annual cancer burden overall. The U.S. Mean expenditure per lung cancer patient was over $35,000. Total cost in the U.S. just for lung cancer management in 2020, $23.8 billion.
Okay.
Even Spain, looking just at advanced NSCLC, costs range from about $11,000 to nearly $33,000.
So compared to those numbers, Turkey's median of $3,200.
It's roughly 10 times lower than some of those figures. It's a massive difference. Really quite astonishing when you see it side by side.
10 times lower. Let
Correct.
that sink in.
Yeah.
That's a staggering figure, isn't it? Why?
Yeah.
What do the researchers suggest causes such a huge disparity?
They point to a few key things. First, and probably foremost, healthcare for cancer in Turkey is entirely state-supported. That fundamentally changes the cost structure compared to systems with, big private insurance involvement or high out-of-pocket costs.
Right, the whole system is different.
Exactly. Then there are currency differences, of course, and also variations in what's called gross domestic product purchasing power. Basically, what a dollar or lira can actually buy varies a lot between countries. These economic factors play a big role in overall healthcare pricing.
So the state-funded model seems like the biggest piece of that puzzle. But, sometimes centralized systems might have different access to the very newest, maybe most expensive treatments. Did the study touch on that trade-off at all?
That's a good point. The study didn't explicitly analyze, say, access speeds for novel therapies or potential quality differences. Its main focus was quantifying the direct expenditures within the existing Turkish system. So its strength is giving us that real-world snapshot of costs as they are under that specific state-supported model. It doesn't really delve into potential trade-offs in outcomes or access compared to higher-cost systems.
Understood. And like any good research, we need to talk limitations. Nothing's perfect. What boundaries should we keep in mind here?
Absolutely. Transparency is key. Well, first, it's a single-center study. So while it's a specialized center, generalizing these findings to all of Turkey, especially maybe less resourced areas, requires caution.
Okay, single center. What else?
They also had to exclude patients treated only on an outpatient basis. This was because of how the reimbursement system works. So you needed at least one inpatient day, even for diagnostics, to get reimbursed properly through the system they were analyzing.
Yeah.
So purely outpatient costs aren't in this data.
Ah, okay. So that might slightly skew the picture if purely outpatient care is significantly cheaper.
Potentially, yeah. Also, the staging categories were simplified, as we mentioned.
Yeah.
Getting super detailed, consistent staging like, 3A versus 3B across a whole decade of records wasn't always feasible. And reliably factoring in USD inflation over 10 years for the cost analysis was also a challenge they acknowledged. Finally, all they got total costs, breaking down exactly how much was for drugs versus admin versus procedures, wasn't possible with the billing data they had access to.
Right. Important context. But even with those limitations, what's the main takeaway, the big message the researchers want us to get from this?
Despite the limitations, the data points very strongly to one conclusion. Early disease control is absolutely crucial for managing overall costs, especially for NSCLC. It might seem counterintuitive, but investing more upfront in early diagnosis and effective initial treatment, it seems to save significant money down the road by preventing progression to those much more complex, expensive, and often, frankly, less successful late-stage scenarios.
So catching it early isn't just better for the patient, it's actually cheaper for the system overall.
Exactly, and they really emphasize that prevention, particularly smoking cessation, is the ultimate cost saver. It's the most effective and least expensive way to cut down the massive health expenditure linked to lung cancer. That ounce of prevention is worth way more than a pound of cure here.
A powerful reminder. Okay, so wrapping up our deep dive today. This Turkish study gives us this unique window showing age, gender, stage, and cancer type all really matter for cost, with different patterns for different cancers. And crucially, just the difficulty of diagnosis itself can drive up costs. So here's something to think about. Given these huge global differences in lung cancer costs, that striking tenfold difference with Turkey, and knowing how vital early diagnosis and prevention are, as this study highlights, what steps do you think healthcare systems everywhere, including potentially your own, could take to both improve patient outcomes and better manage the really steep economic burden of this disease?